Hi, I'm Dr. Anthony Barrett. As a facial plastic surgeon specializing in rhinoplasty, I see a lot of patients who present with crooked noses or deviated noses. And while crooked noses and deviated noses is the most challenging procedure to perform within rhinoplasty, certain things need to happen to give the patient the best outcome. And I'm here with Vicky today, who works in our office, but she's going to serve as my model so I could explain what I do to assess a patient to give them the most natural outcome as well as the best results. I divide the nose into three parts. The upper third of the nose is the bony part of the nose in most people. The middle third is composed of cartilage, and then of course you have the nasal tip. So these three components have to be assessed separately with a very good and proper physical examination, as well as an examination inside the nose where I take a speculum and I look inside the nostrils to look at the septum as well as the nasal valve and nasal airway. So when assessing the nasal bones, you look at both sides because both bones need to be treated differently at times. If the nose is deviated towards the right, maybe what are called asymmetric osteotomies need to be performed, where the bones need to be refractured to be able to straighten the nasal bones. Once the nasal bones have been straightened, then I work down to the middle third of the nose, which is composed of cartilage, typically the septum and what are known as the upper lateral cartilages. This is also treated separately. Typically I will use cartilage from the inside of the nose, like I mentioned, the septum, to be able to then address deviations to the middle third of the nose. And then finally, the nasal tip has to be adequately addressed. And this is composed of two cartilages known as the lower lateral cartilages. And at times, these need to be treated differently given deviations and inherent asymmetries. Crooked noses, like I mentioned, is the most challenging aspect of rhinoplasty, particularly patients who are born with crooked noses or who can't relate it to a previous trauma. This is known as congenital crooked noses. These are historically more challenging because the facial anatomy, the facial skeleton grows into this deviation, while as patients who have had trauma or previous accidents to the face which have created the deviations are typically more readily addressed. Thank you.